Hello everyone. So I just want to start with this topic, which is very important for whether it is oral surgery, whether it is pediatric dentistry or pharmacology, that is local anesthetics. So a lot of questions have been asked like in the exam related to local anesthesia, and some are very simple, and I just want to start with local anesthesia and pharmacology. So let's start. It's from the top pharma. So first thing we must know that like the local anesthesia categories, one is esters and one is like amide. We must know which one is amide and which one is ester. So remember, in amide there is cane and one extra I. So all of them have I and cane, whereas ester it's only cane. So firstly you must know the names like this one. This is procaine, tetracaine and cocaine. Just remember the thing cocaine, and one extra I is in the amide. So this thing. And then we have like the amides, they are metabolized in the liver, whereas ester in plasma esterase. And another thing which is asked is the drugs amide, and it's either it's amide or ester. So first question, we must know that which one is amide and which one is ester. You don't need to remember all the names. Just remember amides are like in the liver and they have I and cane, whereas ester they are only cane. The next thing which is asked is the toxic reaction of the to the local anesthetic, like which causes like the toxic reactions. We must know like which one causes hypotensive shock and which one not. So for this one we have like the prilocaine. Remember, prilocaine causes methemoglobinemia. This is very important. And then we have this one, like the third class, that is of the question. This one, mechanism of action. The first thing, always remember the ion which is related to the local anesthesia is the sodium ion. So it interferes with the sodium transport, doesn't allow the sodium to enter. And then next thing is the important regarding issue absorption of the. So remember only non-ionized, and which is the free base form which will penetrate the tissue. Whereas the question which is asked in the exam is this one. Inflamed tissue has a lower than normal pH, which decreases the amount of non-ionized form available to penetrate. That's why when somebody have like the infection, so it's very hard for local anesthesia to give it like action. And this reason is that because the pH is like it's like more lower than the normal pH, and the availability of free base is very less, thus local anesthesia is less active. Then the another thing is usually the calculation, how we can calculate local anesthesia. And example, how many mg in 1.8 ml of 2% lidocaine solution and 2% in this one. So these questions are asked less in ADAT, but it is very important for like the another exam like NBDE and as well as the AFK. So you must do the normal calculation for this one. All these things you should know related to local anesthesia. And let's do some questions now. Which of the following local anesthesia is like the subject to inactivation by the plasma esterases? So it is you have to look the plasma esterases. For plasma esterases to be like inactivate that one, it should be a ester, because that are like right ester. So for all these like things you have to sort out, okay, just which one is ester, which one is amide. So you can see all of them are like amides, but only procaine is the ester. So the answer for this one is the A, that is procaine. So next move to another one, that is procaine differ from lidocaine in that. So remember, so procaine is the ester, lidocaine is the amide. So look for the options, you can read the options, and basically it is procaine is a p-aminobenzoic acid and lidocaine is not. So another statements are like you can sort out and like cut it off and see this is the A option. Then we move to Next one, which of the following local anesthesia would be expected to produce sensitization reaction in patient allergic to lidocaine? For this question also you must know, okay, the cross allergy will be the same. So if the lidocaine is the ester or amide, so another one should be like that. So lidocaine is the amide, so we have to look for the amides. So remember, again we have I and cane, so this one, then we have prilocaine, then this one. So let's see which has the A, D and E option. That is the number 2. This is how you're going to solve this type of question. And then we have another one. Then we have the hydrolysis of procaine occurring liver, lungs, plasma, muscles and kidneys. So answer is procaine is the ester, so it will be in the plasma. Then we have which of the following local anesthetic is subjected to inactivation by plasma esterase. So again, in other words, and we see it will be ester are metabolized by plasma esterase. The activity of procaine is terminated by, so it can be terminated by metabolism in the liver and by pseudocholinesterase in the plasma. So they say terminated by some question, but they will throw the question in different form. Remember, procaine is the ester. Esters are metabolized predominantly by pseudocholinesterase, but also some extent to ester in liver. And then we have all the following factors determine the duration of action of conduction block with amide type local anesthesia, except whenever you're going to like see the except question, try to see they are asking except, so to like consider other option which are like correct. Okay, so like which one you see, okay, this one the indication and contraindication, like that. So for this one the answer is blood plasma cholinesterase levels. So because amide, they're metabolized in the liver, so they will have all these effects, right? These factors will determine their duration, but blood plasma cholesterol level, because they are not esters, so it will not affect. So always these all are correct. So except for exception, look for the one which is not related to that. And then we have which of the following is a contraindicated for a patient who had allergic reaction to procaine 6 months ago. So like if it has a procaine, so we have to look for the option like which is also a ester, right? So lidocaine, no, it is amide. This is also amide, and this is not considered antihistamine. So for this one, if patient has the allergy to procaine, they will also have allergy to tetracaine, which is also belong to the ester. So again, they will ask you question like this. So it is a very important topic. So thank you.